Hello out there in television land, and welcome to yet another edition of It's Your Health. Philip.
How about people on the internet watching it?
Oh, I'm not very technical. You should know that, sweetheart. So those included, welcome to yet another edition of It's Your Health. Philip Benyo with my bride, bringing you the latest and greatest in healthcare information. We'll be right back after this brief commercial message, and make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health.
Any of them.
Especially if she's talking. We'll be right back after this brief commercial message. You're watching It's Your Health. Well, welcome back to the first edition of It's Your Health. How do you like that little joke there, sweetheart?
What joke?
About cantaloupes?
Oh, it's cute.
Oh, okay.
You know, they have to elope. It's cute.
Okay, just like me. All right. Maybe we should head on here for our headlines, if you don't mind.
Okay, this first one always reminds me of Christmas. Eating Brazil nuts daily may reduce inflammation and improve gut health. And I remember my dad and my mom always had Brazil nuts, but I could never crack them open.
Oh, yeah.
So you get your exercise by opening up a Brazil nut. They're high in selenium, an essential mineral with antioxidant and anti-inflammatory properties. It's safe and beneficial for most people to eat them. Limit consumption to 1 to 2 nuts per day because you don't want to get selenium toxicity.
Selenium is an essential micronutrient. We don't make it, and it's important for immunity and cellular repair and fighting radicals in our body. So yeah, 1 or 2 Brazil nuts a day should do it.
That's not many.
It's not many, but it's better than nothing.
Okay, so you're going to get me some?
As soon as we leave.
Oh, okay. Next headline. Falls may increase dementia risk in older adults. Older adults who have experienced a traumatic injury as a result of falling, are 21% more likely to later receive a diagnosis of Alzheimer's disease or another related dementia. Older adults who have been hospitalized because of the fall should undergo cognitive testing.
It's hard to say what came first, the chicken or the egg. Are the falls the marker for a dementing illness, or is the dementing illness causing the fall? This article suggests it's the first one. And falls are game-changing, life-changing events, especially if something fractures, like your hip. So there's clouds on the horizon out there. If you are falling or know someone who's falling, they should get some cognitive testing and maybe some gait impairment testing along with balance treatment with physical therapy.
And there's lots of things on the internet to tell you what and what not to have in your house if you're prone to fall. You know, like
throw rugs.
Throw rugs would be one of the big ones.
And steps.
Steps, you might not have a choice on that one. Okay, another headline. Vitamin D supplements may help improve blood pressure, cholesterol, and insulin. If you take a dose of about 3,000 in units of vitamin D per day, it reduces blood pressure, total cholesterol, hemoglobin A1C, I know that one, and fasting blood insulin and glucose. And that is just vitamin D.
Well, in northeastern Pennsylvania, virtually everyone is vitamin D deficient till proven otherwise. We don't see the sun, our diets may be lacking in it, and it's truly an epidemic. So make sure you're on a supplement of vitamin D. And You always can get it measured in your blood to see exactly where you are. If you're very low, you might need prescription vitamin D, which is 50,000 units, either weekly or twice a month.
I just got vitamin D3.
That's exactly what we prescribe, yeah, D3.
Oh, okay. That's what I have. I have a question for you, but I'll answer it too, so it's all right.
What's new about that?
Nothing. Are all ultra-processed foods equally bad for health? Eating ultra-processed foods has severe consequences for health, such as deli meats, hot dogs, sugary drinks, salty snacks. They are all things you want to avoid.
Well, instead of eating the apple, of course, we eat the apple pie. And some of the things that make things ultra-processed are, get a load of this list: preservatives, colors, flavorings, stabilizers, emulsifiers, firming agents, taste and texture. And about 73% of the entire U.S. food supply is considered ultra-processed.
Wow.
And there are illnesses associated with ultra-processed foods. About 40% of mental illnesses, we feel, could be in part magnified by ultra-processed foods, as well as 40% of cardiovascular, cerebrovascular diseases. So it's the new poison out there. And so we need to define what we're eating a little bit better and read the labels. If you are seeing hydrogenated oils, for example, you better put it back on the shelf. Start educating yourself about what you're eating.
I remember many years ago when I was a teacher and people were talking about red dye.
Right.
And how that was a problem. Did you just take that from me?
Yes, we're moving right along, sweetheart.
Sweetheart.
That means something bad's gonna happen.
Okay, can arm position affect your blood pressure reading? The reading is an important part of preventive health care. You don't want your blood pressure too high, but you also don't want it too low. So show us, how should it be?
Well, it's a silent killer. Most people know the pressure of their car tires than their own blood pressure, and it's essential you have it taken correctly. If you just go and let your arm dangle down and then take your blood pressure, it's going to be a few points higher just because of that position of the arm and hydrostatic pressure and some other issues which we don't understand. And if you have it even on your lap, you may get a few points higher than you should. The ideal is to have it resting on a table with the cuff equal to your arm in terms of height. So when you're taking your blood pressure, make sure it's correctly, that your arm's supported by the table and the cuff is close to your heart.
It reminds me of when you go for blood work and they put your arm up on there like that.
Good point, yeah.
I don't think that happens when I go for my doctor's appointments. I think my arm is down like this.
Speaking of doctor appointments, get a load of this bill from St. Joseph's Hospital, where I was born. This was in 1950. And 7 days in the hospital to have a baby, ended up costing $81.
And it was 75 cents to get your birth certificate.
Wow, have things changed? I think if you get 2 Tylenol in the hospital today, it's $80.
Caring for the baby was $12.
All right, we'll be right back after this brief commercial message. Remember, you're watching It's Your Health. Right, sweetheart?
Is that what we're doing?
Yes, that's what we're doing.
I'm with you.
We'll be right back.
Okay. Pay close attention to this. If a girl can watch a full football game, knows what's going on, and cheers for the Fighting Irish, marry her.
I did that.
Oh, okay.
Okay.
Okay, then that's done. Good.
All right.
All right, so we'll go right to our headlines then.
Please do.
We're done with the headline about marrying me?
Oh, it's well done. Don't worry.
Okay. Is it better to eat several small meals or fewer large meals? And that's a big thing on people having diets. They're being told, eat 3 meals. Other diets say eat 1 and then wait 10 hours before you eat again. The answer is, I learned this from him, calories in, calories out. It doesn't matter.
It doesn't really matter whether you do intermittent fasting or stand on your head. If you are consuming more calories than you're burning up, you're going to gain weight and not lose it. So you have to really watch portion control and what you're eating. Of course, we talk about pasta and breads and those types of things, which are complex carbohydrates. We have difficulty handing them, and they end up packing themselves on our hips and around our belly. So you just got to watch the calories and portion, and you'll lose the weight.
He makes it sound so easy. Okay, this is interesting, I think. Can tattoos cause blood or skin cancer? Some research has found a link between tattoos and an increased risk of cancer. And recent evidence appears to suggest that tattoos could heighten the risk of blood cancer in particular.
Yeah, particularly lymphomas. We see that perhaps in some people with tattoos. I would say 25% of people have 1 and even more tattoos. And it depends, of course, where you live, but it's sort of a startling, maybe not so surprising thing. If you're putting something foreign in your body, the body may react poorly to it.
Any size tattoo was linked to a 21% higher risk of lymphoma, a type of blood cancer. 21%, that's a lot.
I'll say.
Are you sure you meant to put this on here? Since when are we doing science?
Well,
Weather changing El Nino and La Nina? Do you have anything to say about that?
well, we of course are going to be guided by this winter, and the winter patterns may be set up right now by El Nino, and how they will cause either more of a drying spell or more of a wet spell, a cold.
And they come from the Pacific Ocean.
Right. So I think that's important for your health.
And believe it or not, the temperature swings were more prevalent in the past than they are now.
Right. Exactly.
You said right.
Yes, dear, I should have said. I'm corrected.
You
Sorry.
agreed with me. That was great. I hope Sammy got all of that.
He has it.
Okay. Preventing a first stroke may be possible with screening. Healthy lifestyle behaviors such as good nutrition, smoking cessation, of course, and being physically active, along with routine health screenings and managing risk factors and medication for stroke can help prevent individuals from even having a first stroke. Because once you have one, then you're in trouble.
Well, yeah, it's not far behind for other illnesses. It's hardening of the arteries, so it's kind of something we've preached about before. Normal blood pressure, not smoking, staying active, low cholesterol, taking care of your diabetes.
Carbonated drinks, fruit juices and drinks, and too much coffee can increase the risk of experiencing stroke and intracerebral hemorrhage. Drinking more than 4 cups of coffee daily raise the likelihood of a person having a stroke by 37%. Drinking less than 4 cups was not associated with any kind of problem. What's really interesting is if you look at tea and you drink the same amount, such as the Earl Grey or breakfast tea, it lowers your risk of stroke by 29%. I hate tea.
I'll tell the Coca-Cola company that as well. So yeah, no more than 4 cups of coffee a day, and try to change it to tea.
Well, this one I read about, and it's about lung cancer. And of all the cancers that we hear about, this is the second most
Prevalent?
prevalent,
Prevalent.
yeah, popular. Lung cancer comes in second. I couldn't believe that. Tell us more.
Well, the 3 cancers that we are concerned about, of course we're concerned about all of them. The ones we can screen about the most would be breast, colon, and lung cancer. And lung cancer is very important because it's very prevalent, and the screening test for that would actually be a CAT scan. And they do offer CAT scan imaging to patients who are at risk for lung cancer. So here's this list of patients who are eligible for CAT scans that would screen for lung cancer. Adults aged 50 to 80 years who have a 20-pack year smoking history and who currently smoke and have quit over the past 15 years. A pack year, for example, would be I smoke a pack of cigarettes for 20 years. That's 20 pack years. So that would make you eligible for lung cancer CAT scan screening. Or if you quit, but had smoked over the past 15 years. Talk to your doctor about it. It's very important.
Let's pretend you didn't do those things. You didn't do the smoking. Is it still possible that you could have lung cancer and not know it?
Correct, correct. And so you would want to talk to your doctor about what symptoms you might be having and to kind of take it from there. Now, we have experienced over the years such great feedback on our show. A lot of people watch it. And Sammy, am I right to say that our ratings are higher than Sam Lassant's show? I knew it. I knew it. So listen, we have a letter here. We'd like to start a new session here called Dear Kathleen.
Uh-oh.
Mary from McAdoo writes, I love watching you two on your show. You make a great couple.
Good. Of what?
They didn't say.
Oh.
My husband is becoming more distant. He doesn't talk. Not sure he is listening to me.
No, probably not.
Help. Any thoughts?
Well, I'll tell a story. You won't like it. There was a point in time where we were mad at each other. I don't even know why anymore, but we weren't talking, weren't touching. He would talk on the phone to other people, but not to me, and we were just ignoring each other. So I decided I had to fix the problem. And one day he came home from work, and I had on our favorite song, and I took his coat off him, and I put my arms around him and forced him to dance with me to the song. You remember that?
I remember that, yes, indeed.
And you know what? It changed everything. He got in a better mood. He was talking to me. He was touching me because he was dancing. And sometimes, I hate to say it, it's up to the man not to be the one to do it, but the woman to put the pressure on to get everybody organized.
All right, Mary from McAdoo, there's your answer. Buy the book, Men Are From Mars, Women Are From Venus. I recommend that highly. We'll be right back after this brief commercial message from Watching It's Your Health.
And just look at the sky. In the past couple of weeks, the sky has put on such a show for us. Here's a picture of a comet very near to where we live, and if you look closely, you can even see the head of the comet. And then we had meteorites. We had meteorite showers coming in, and a gigantic full moon. So the sky in these couple of weeks has really gone out of its way to help us enjoy what we have.
I see the stars in your eyes every night, sweetheart. So, and don't forget the Northern Lights.
Oh, that's right. And we saw the Northern Lights too.
Yes. So,
That was, I never thought we'd see those. Oh, I thought we were going to go to Norway.
not this lifetime.
Okay, how about if I talk about this? The effect of frailty on efficacy and safety of intensive blood pressure control in older adults.
Yeah, that's a mouthful.
Yes, it is.
I told you that blood pressure is a silent killer. We need to make sure it's under control. Generally, 130/80 or less is where we would like to be. Some people have found that if we treat you more aggressively with your blood pressure and lower it even further, good things will happen in terms of your health. But the other side of the coin is we overtreat you and you're elderly, you're going to stand up, get lightheaded and dizzy, fall and hit your head or break a hip. So it's kind of a tough balance there. And I think the take-home message is get a blood pressure machine, check it, write it down, let us know where you're trending with regards to your blood pressure.
Bring your machine into the doctor so they can compare it and see how you're doing.
That's a good idea. And we'll make sure you're taking it correctly.
Okay. Does lowering blood pressure, as you just mentioned, decrease cognitive functioning in older adults?
Well, what they're getting at is, again, a healthcare benefit of making sure your pressure is where it should be, 130/80 or less. And say you're 150/90 and you say, oh, well, that's okay. You're going to run into problems in terms of your cognitive health, as well as your other hardening of the arteries types of things. So again, we want it to be kept normal. A little lower is better, and you're going to end up doing better in the long run if you have normal blood pressure.
Gotcha. The next one is on teeth, moving from that to teeth. And I have the most wonderful dentist in the world, but that's all I'll say about him right now. If you want to age gracefully and slowly, one should consume a healthy diet and combine it with an excellent program of dental hygiene. That means brushing your teeth, flossing, using a water pick, everything, because it makes a difference.
Oh, there's no doubt. People with bad teeth generally have bad things happen and have worse outcomes. So dental health is crucial.
Yeah, and if your gums bleed, go see your dentist. Semaglutide? Mm-hmm. What is semaglutide?
Ozempic,
Oh, I heard that.
the so-called GLP-1s.
Boosts heart health, weight loss, but may lead to gut problems. Diabetes medications based on semaglutide deliver important cardiovascular benefits.
Ozempic certainly has taken over the country, and you can see people who have lost and shed quite a bit of pounds in a very short period of time.
And you can usually tell by looking at them.
Yeah, you say, wow, where's so-and-so? And the way it works is it basically tells your brain your stomach is full, which can lead to GI side effects, early satiety, which means you kind of lost your hunger or appetite, maybe nausea. There could be some diarrhea involved because your gut may not be able to stand a heavy meal that you've taken. But the benefits that we are seeing with these medications is through the roof. Get a load of this list here. Deaths from causes related to cardiovascular disease, down 17%. Hospitalizations for heart failure, down by almost 80%. Non-fatal myocardial infarctions, heart attacks, down almost 25%. The need for bypass surgery, down 25%. Strokes in people with diabetes, down 35%. This is unbelievable. Death from any cause, 20%. I mean, it's like we should be on this as a vitamin.
So I should take it.
Not just yet. I don't want you. I don't want you skinny. So.
What does that mean?
It means nothing. It means I want more to love. Okay.
Never mind.
So. you know, I'm waiting for the shoe to drop on this medication because the benefits are just overwhelming. So, and part of the problem is that it's insurance driven. We have patients who would benefit from this, but their insurance won't spring for it just yet. So I think the insurance company, it is, the insurance company has to kind of catch up with us. And nobody knows exactly what's going to happen when you stop these medications. I'm not so sure you can be on them forever. When you stop them, are you going to gain the weight plus? And so we worry about that. But so far, this medicine is better than actually having gastric bypass surgery. It's hard to believe.
Wow.
But talking about nutrition, we're moving right along.
Talk about what's on my plate. And my plate has replaced the triangle that used to be around for what you should eat and how much you should eat. You measure what you eat by what's on your plate. So half of your plate should be lean protein and grains, and half of your plate should be vegetables and fruit, mostly vegetables and some fruit. And of course, we all know the good things, beans and peas and chicken and turkey, and eggs are popular again, and nuts and seeds and whole grains, brown rice, not white. And my plate also shows you next to it a glass of milk, and you should try to drink low-fat or no-fat milk. Even soy milk is okay. So now it's my plate that they recommend.
Sure, instead of the pyramid. Well, there it is, the fastest half hour in television history. We are going to end our show a new way each time. We're going to go back at least, 20 years maybe, to when we were doing this show at the old studio, Samsung Productions on Broad Street. And this is the way we ended the show at that point in time. So let's show our viewing audience how we're going to end the show today. Okay. Thank you for watching It's Your Health, allowing us to come into your rooms and entertain and inform you. Inform.
You always make new words up as we go along.
I should run
We're informing you both on the internet and on television.
That's true.
And we hope that you'll join us again when things will probably be even more crazy than they are today.
We can't wait. Thank you for watching It's Your Health.